Hello, my name is Jeremy Lavine. I am an assistant professor of ophthalmology at Northwestern. I'm a vitreoretinal surgeon. I've been here for 5 years and change. And I'm going to tell you about an interesting case that presented to us, of course, in the middle of the night. A middle-aged working woman was doing some metal work when a piece of metal grinding, despite eye protection, flew into her eye. And as you can see in this CT scan here, the very large white rod is a piece of metal that is piercing the cornea, going through the iris and through the lens into the vitreous cavity. She presented with very poor vision, only able to see light, an extreme amount of pain, and very high eye pressure. So she was transferred to Northwestern from an outside hospital and pretty much immediately taken to the operating room. In the operating room, our major goal was to take the piece of metal out of the eye because she was in extreme amount of pain, and it has a large potential for infection that could lead to ultimately not only loss of vision, but loss of the eye completely. So we were able to sort of go inside the eye, and because it was kind of like embedded flush, and sort of go inside and sort of push it out so that we could grab it with a big forceps and yank it out of the eye. After we yanked it out of the eye, we had an important decision to make because it had violated the lens. And when the lens is violated, that can lead to a lot of inflammation in the eye and also high eye pressures and a lot of pain. So we cleaned out the front of the eye of a lot of inflammatory debris and sutured the corneal wound. And after we did that, we had to decide whether or not we wanted to take the lens out of the eye in its entirety. Doing so would decrease the risk of inflammation and pain long term, but would lead to worse outcomes compared to letting it scar, heal, and being able to do cataract surgery. So what we decided to do after we cleaned out the anterior chamber, the front part of the eye, we found that the hole in the lens was not very large, and it wasn't leaking a lot of stuff, a lot of debris and material. So we decided not to take the lens out and to let it scar. We waited a month or two for that scarring to happen, and as you can see in the picture, she has a very bad cataract, but she never developed a severe amount of inflammation or pain. So this very bad cataract obviously needed to be removed, but by letting it scar, she was able to undergo a more traditional cataract surgery where we were able to have a lens placed in a near normal anatomical position, and that was done by my colleague, Dr. Ramez Haddadine. And then after cataract surgery, as you can see in this ultrasound image, there was a lot of debris and lens material in the back of the eye. So ultimately, after we let her heal a little bit, we did an additional surgery to clear out the debris in the back of the eye. And the amazing part about this case is she is now 20/20 vision with a pair of glasses and on no drops and doing and feeling great. And so that's our story of a very successful outcome with an intraocular foreign body. And thank you for listening.